With me now, Jay Newton-Small. She is a contributor for Time Magazine and the founder of MemoryWell, a digital platform that helps seniors tell their life stories. Good to see you, Jay.
Hey, Fred.
So we've heard, from two governors now, just in the last 30 seconds, say how vulnerable nursing homes are. And yet we're also hearing about staffing shortages, people in these facilities who are getting sick while they're caring for people who are sick and now dying. Do you feel like the problem is being underreported, mainly because of perhaps access?
Absolutely, Frederica. I think that you aren't hearing about what's happening in these facilities exactly because of what we saw in Florida, which is the government saying, no, we're not going to give out the names of these communities that have experienced COVID. It took a lawsuit and essentially and a lot of pressure from groups like AARP for Governor DeSantis to finally release the names of those 302 facilities because I think there's a lot of worry that people have that their seniors are potentially not being cared for or that they might get infected in these places. They might then move to try to pull them out, and they're trying to limit the amount of interaction of people going into these communities, people visiting their loved ones at this time, so that it doesn't go even further. But it is a real concern, and you have, frankly, the oldest and the frailest of our society all gathered in one place.
Right, and it really is not cut and dry. Perhaps you heard, the employee at the Los Angeles nursing care facility that Paul Verkaman spoke with earlier, talking about, people who are caring for folks in these nursing care facilities. I mean, they're working in very close confines. They're having to be very personal. You can't social distance. You have to bathe them. You might be feeding them. You are also, really showing them love. So it's a very difficult situation because many of the care workers have to be in close confines, and you are talking about what may be a very vulnerable population on top of that.
Absolutely. I mean, Fred, it's really difficult, I think, for a lot of these frontline caregivers. Most of them make minimum wage, and for them, it's just potentially not worth it to go into work if it means exposing their family, putting their families at risk. I've seen communities, nursing homes have to transfer patients and shut down in states because they haven't had enough staff show up, or dozens of staff have simply said, we're not going to risk it, we're not going to be showing up to work and putting our own families at risk, and so they have to transfer the patients to other places. One way I think the government could actually solve this is to simply say, hey, Medicare and Medicaid, let's pay overtime for some of these workers. Let's give them the benefits of overtime, which right now they do not enjoy. And so they're limited to 36-hour work weeks, really getting minimum wage, which means they often have to double up on jobs, working at two different facilities or working in home care, which then doubles the exposure.
That's another potential problem, because now you're potentially, maybe you're asymptomatic and now you're going to another facility and potentially exposing others.
Exactly. It's a real risk for these workers. And so one simple way to solve that is to just allow for overtime. That's one immediate step the government could take.
Do you see that potentially there will be other maybe long-term changes in the making as it pertains to how the elderly are being cared for, how these facilities, receive supplies, equipment, how they're able to do their jobs?
Sure. I mean, I think you've seen so many times now where these facilities, they've tried so much to test to make sure that their staff doesn't bring the disease into the community, but the tests, aren't 100%. They're not foolproof. There's a lot of false positives or false negatives. And there's a lot of asymptomatic people who don't have fevers, who aren't coughing, who are carriers of the disease. And so I think we really fundamentally as a country coming out of this are going to have to rethink, are we going to still want to house and pool all of our oldest and frailest in one place, or are we going to rethink that model, maybe not have them in a building? There's been a lot of movements in recent years to move away from a building model where you're putting them all in a corridor, where the risk of potential infection is a lot higher than, let's say, they have, for lack of a better word, they call them granny huts, where they put them on a property. There's a bunch of little huts. They each have their own sort of HVAC systems. They're able to isolate when they need to isolate, but come together in communal spaces when they want to come together. Now, that's obviously more feasible, I think, in states like Florida or Arizona, where the weather is nicer, in areas that but in urban areas, how do you do that? And
Yeah.
it's going to be expensive for states to sort of simply take, thousands of nursing homes and turn them into those kinds of facilities. It's frankly impossible. So I think there's going to have to be a lot of thinking on how we really handle and treat seniors and the elderly moving forward after this.
Yeah, our most vulnerable of our population made even that much more vulnerable under the current circumstances. Thank you so much, Jay Newton Small. Appreciate it.